Now it's working. Okay, so we're gonna start over.
Yeah, we can start over. I'll start the video over, or the timer over.
Okay,
And they can start the video over.
so to start
Okay,
over.
Are we ready?
We ready?
Is it working? Check.
Yeah.
Okay. I use it so much to control my emotions, although of course it never does. It makes them worse. It's not a friend, but an emotional support. I have a love-hate relationship with food. This is again from somebody who is currently battling their eating disorders, and I got that from the psychological responses of eating disorders and obesity. To define an eating disorder, it is any range of a psychiatric disorder characterized by abnormal eating habits. And today we're going to discuss the three main types of them, though of course there are different subcategories that everybody is different with. So we're going to talk about the categories that they are, the symptoms that you'll see, the statistics of it, the causes, and some treatment options that we could go through. So, to start, we have anorexia nervosa. Anorexia is characterized by an obsession with weight loss and to be thin and skinny and perfect. Symptoms of it are extreme weight loss, lack of eating, distorted body image. So when somebody looks at themselves in a mirror, they don't see who they truly are. They only see what their mind tells them they should be like. They also have dental issues and have a big fear of gaining weight. 2.5% of men and 1 in every 200 women experience anorexia nervosa. And some future risks of it are irregular menses for women, because the second your body drops below 85% what it should be, your body will stop going through menses. And for men, it will go through irregular and lower sex drive. And as always, you'll have a persistent psychological issue, because it is more like a self-harm issue than something that you can catch or cure. Next, we have bulimia nervosa, which is also categorized as somebody who is obsessed with being thinner or obsessed with their body weight in general. It is also characterized as somebody who binges and purges, although purging doesn't always necessarily have to be inducing vomiting or taking laxatives. It can be any sort of compensatory behavior afterwards. 1.5% of women and 5.5% of men experience bulimia nervosa in America today. Some symptoms of it are an obsession with weight loss, as stated before, and they also feel guilty or depressed after eating. They also eat lots of food in one sitting versus somebody else's normal portion size meal. They'll eat twice that, 3 times that, and then afterwards they'll go through into the compensatory behavior. Some of them will go to a bathroom and vomit, take a laxative, or maybe they'll go to the gym for 3 to 5 hours. And some future risks are dental problems due to all the acid coming through your mouth, as well as digestive issues because you've forced yourself to get rid of everything in your body, so future stuff's gonna be pretty bad. You also have esophageal problems from all the acid going up and down your esophagus. From there, you could also have ulcers due to all the upset in your stomach, and you'll have irregular hormone levels, as well as heart disease and anemia. From there, we have binge eating, which is still a form of an eating disorder. Some people don't consider it to be, but medical assistants do. It's when you eat a lot of food in one sitting without any compensatory behavior. Symptoms of this are eating very quickly and at irregular times, whereas in you could be at a dinner table and have dinner, and then an hour later, 30 minutes later, that individual will be eating another meal again. It also happens at random times, and they eat as if they cannot stop. Like nothing will stop them from eating. They have no control of it, and they no longer feel hungry. They just know that they want to eat because eating makes them feel better. It gives that individual a sense of control. 3.5% of women and 2% of men in the US are diagnosed with this eating disorder. But again, with the presentation that you gave, a lot of people might have it and they just don't realize it. Some future issues that you could have with binge eating is obesity, diabetes, heart health due to the gain of weight, high blood pressure as well. Now, eating disorders are hard to spot, especially if you're just thinking about yourself and you're like, oh, I'm okay and stuff. But you also need to consider your friends and family near you, because the risks of these in the future are very harmful and could lead to death. For bulimics, how to spot one: if they're eating and they don't seem to have a sense of control, and then afterwards they'll go to the bathroom for a little while and come back and they smell like vomit, or their cheeks are puffy, or they look flush after they come back from a bathroom after having a meal with you. They're also very secretive sometimes about how they eat, whereas they might eat like half of their food with you and then take it home and eat the rest of that plus some at home in the privacy of their own bedroom. They also have scars on their knuckles from putting their fingers down their throat to induce vomiting. Binge eating also has a lack of control while eating. And like I said before, weird and oftentimes, if you notice that when everybody else is full after dinner and they're continuing to eat, that's a sign of binge eating. And also a lot of weight gain. If their weight is up and down, up and down, and up and down, that's a sign of bulimia. But if it's just a constant gaining of weight, that's usually a sign of binge eating. Also for binge eating, a sign that you should take into consideration is if an emotional time is happening or some kind of turn of events is going on and they're turning to food to make themselves feel better. That's a sign of being a clinical binge eater. And next we have anorexia. Anorexia is again a sign of extreme weight loss. And if they exercise excessively, if they are very private about how they talk about their weight, or if they only ever talk about their weight, that's a sign of anorexia. Some questions that you should ask yourself about your friend or family member, or even yourself, is how do they feel about their present weight? How often do they scale themselves? How often do they talk about their diet? What are their dietary practices? And when was the last time your female friend had a period? Because if it's been several months for no apparent reason and you can tell that they've lost a lot of weight, that is a sure sign of anorexia. Some causes today that we probably could just assume: self-body image are on the downhill slope due to things like social media. Self-esteem is lower. That individual has experienced some trauma or abuse. Or if they're using it as a sense of control. Some people, like I said before, this is a self-harm psychological disorder. Some people will cut themselves, but these people turn towards food and harming themselves to try to be perfect, to control something in their life. Some treatment options that you could go to are art and music therapy, which I think is a wonderful choice because it is an outlet for self-expression for that individual. It gives them a place to be creative and open about their issues without having to verbalize them. And through art and music, it gives them a sense of control. They can control what paint they use. They control how they use their paint. They control what music they listen to, because control is a big part of eating disorders. Also group therapy, because being around peers that are experiencing the same thing as you is very helpful in most cases, not just eating disorders, but any other kind of issues you're going through. And it also provides support and understanding for people who are on the same side as you. And then worst case scenario, if you notice that somebody has fallen below 85% of their body mass, they need to seek medical attention immediately. Otherwise, there are risks for fatality. So, closing, we know that eating disorders are, as we stated before, any range of psychological disorder characterized by abnormal or disturbed eating patterns. Those characteristics that we talked about were extreme weight loss, binge eating, purging, compensatory behaviors, and there are many different causes. It varies from person to person. You can't take a textbook and try to fit somebody into it. So, are there any questions that I could answer for you guys? Having an eating disorder does not define you as a person. It is an illness, and you should seek medical attention and help if you have it. Thank you, guys.
Thank you.